Hi, I'm Louise Wood, and it's my great pleasure to welcome you to this Impact Framework and Cultural Change 2021 conference. So we've got some great content for you, podcasts, webinars, debates and talks to stimulate your thinking and planning for the future. So special thanks to the welcomes Jessica Romo, to NIHR's Mark Taylor, and folk from Alberta Innovates, the Health Foundation, Aquas, the Impact Academy and Novo Nordisk Foundation. We've got some great content for you. So the topics that are going to be explored include the use and development of impact frameworks, how policy can affect practice, why impact assessment and cultural change are interlinked, and some webinars looking at lessons learnt globally on the use of new impact assessment tools. So as you know, this conference was actually scheduled to be held in person in October of last year, but sadly had to be postponed because of the pandemic. It's perhaps worth us just pausing to think about the tremendous impact of the collaboration across nations from the research community to tackle the impact of the pandemic, which has been quite extraordinary. So I just want to say a massive thanks to the research community, the health and care system, and to colleagues in other research funders for that tremendous collaboration. I'm just looking at organisations involved in organising today's event. We had the COVID-19 Therapeutics Accelerator supported by the Wellcome Trust, new work on antibodies funded by Novo Nordisk, critical work done by the Health Foundation looking at the impact of the pandemic, health inequalities in the health and care system. And then NIHR has stood up infrastructure to support vaccines and therapeutics trials, as well as working with the Medical Research Council to fund platform therapeutics trials, which have yielded results that have enabled lives to be saved, many thousands of lives to be saved across the world. So back to today's event. So each of the organisations that have been involved in developing this conference have had their own impact journey. For NIHR, we're a young organisation. We're only established in 2006, and as we're all acutely aware, it can take several years for the impact of health research to come to fruition. For those of you who are interested in an early attempt that we made to look at the impact of NIHR, I'd refer you to a synthesis that RAND Europe conducted for us around the time of our 10-year anniversary. So we invest about £1.3 billion in research in the health and care system nationally, as well as in partnership with lower middle income countries. And we're about halfway through a 5-year impact strategy. So we have been doing a lot of groundwork to prepare for the development of an outcomes framework to look at the impact of NIHR. So that has included helping our workforce to become more impact literate, developing adaptable logic models to underpin key investments and strategies, as well as thinking about how we can best collate the evidence to match against the outcome framework so that we can look to evolve as an organisation to maximise our impact for the benefit of patients, carers, the public, health and care system and economic prosperity of the country. So we know that we can learn a lot from other organisations, which is why we're always keen to be an active player in national and international impact fora. And in fact, obviously our involvement in organising this conference is testimony to that recognition of the real benefits of collaboration and learning from others. So tomorrow, Jessica Roma from the Welcome is going to be leading a webinar looking at impact frameworks. She's going to look particularly at work done by the Welcome, NHS England and Improvement, NIHR, thinking about the approach taken and lessons learnt and what could be distilled as best practice in the field. So in NIHR, we've been watching really closely as the Welcome developed its success framework and sought to implement that. River has been leading on the development of our outcome framework for NIHR. Work on that is coming to completion, and I'm expecting that we'll be able to publish a beta version of that later this spring or summer. So we have got some wonderful podcasts and videos that have been released as part of this conference, so you might want to check out those which are looking at patient involvement in evaluations, critically important area. Global health research impact, and there are also some viewpoint podcasts from some of the organising committee. Today's webinars include a debate on impact sections in funding applications and also a session on cultural change that can be affected via impact strategies. So this is a global event, so there are timed events to ensure access and availability for interaction for colleagues in Australia, Canada and elsewhere in Europe. So it just remains for me to say I hope that you really enjoy the conference. I hope you learn something, that it inspires you to perhaps think differently, and most importantly that it encourages you to go out and tell the world how your organisation has made a difference. Thank you. Bye bye.